started. I'd like to welcome everybody here to the regular monthly meeting of the Indian River County Hospital District. We have more people than normal. It's good. Thank you. And if anybody who happens to be watching us, welcome to you as well. We will start with the invocation from Tracy.
Do you want me to go down?
You don't have to, but if you'd like to.
You can. Yeah. Necessary. All right, I want to wish everybody a Merry Christmas, Happy Holidays. If you would join me in prayer, please. Dear Heavenly Father, thank you so much for this holiday season and the opportunity to see just your wonder and your splendor and all the different gifts and blessings that are around us. I pray that you would be ever present during this holiday season, Lord, that you would be especially with those that are first responders and with our military and soldiers. And I pray, Lord, that you would be with our community, Lord, that especially during this time when things can get a little chaotic, Lord, that you would just be with them and show peace and blessing upon their lives. Be with us at this meeting. Help us to make wise decisions that represent your plan and your purpose for our community. In Jesus' name, amen.
Amen. Thank you.
Very nice.
Pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We'll start with the consent agenda. Can I hear a motion for the approval of the chairman's meeting minutes dated November 20th, the regular monthly meeting minutes dated November 21st, and a December disbursement of Mr. Jones?
$1,107,494.81.
So move.
Second.
Okay, all in favor?
Aye.
Okay. Yeah, since this is our last meeting of the year, which is amazing, 2019 went by very, very quickly, I think. It's been really an exceptional year for Vero Beach, obviously the centennial and all the centennial stuff that happened, which is absolutely wonderful. This was the successful transition of the Gifford Health Center, and that took a whole lot of people to make that happen, and it's going very successful, so really good stuff. First year of transition of Cleveland Clinic, which has been very positive for the community as well, and so I think from our perspective, it's been a very good year for us and for the community. So now we have 2020 ahead of us. We can do even more, and it's great. So I just want to thank everybody that's been part of it and all the agencies that do so much good in this community. So we will continue to support that. So, District Council. Jennifer.
Thank you, Madam Chair. This past month, I was occupied working with our treasurer and our executive director to review the process for investing surplus funds in accordance with our special act and the Florida law, and have continued to review related documents and paperwork associated with the proposed company our treasurer has recommended, and will continue to do so as the need arises. I've also worked with the board to complete the board's annual compensation committee matters regarding the district staff this past month, and then have continued to review all monthly meeting minutes from the monthly special meetings of this past month and regular meetings, and respond to trustee questions as they arise. Are there any questions for me at this time? Okay.
No, thank you very much. Okay, financial statement review. Alan.
Well, as you might expect, the district remains in sound financial condition. As of November 30th, our bank account totaled just a little under $8.5 million. And of course, we just approved distribution of payments of about $1.1 million, principally to programs that we support to improve health care in the county. And while that's going on, we've also started to receive more tax revenue as prompt paying Indian River County taxpayers paid their property taxes, of which the hospital district receives a relatively small amount. Just emphasizing that. In November, we began our new money management effort, which is reflected in your minutes as well as emphasized by Jennifer in her report. On November 27th, transferred $5 million to Water Walker, and we earned about $900 in the next 3 days. Since then, we received more tax receipts and have subsequently deposited an additional $6 million. So our total is a little over $11 million, earning interest at the rate of 1.61%, at least based on last year's. It may be a little different this month. The details are available monthly from Executive Director Anne Marie Soriano for those of you that are interested in our progress. In addition, we'll be maintaining probably a little over $1 million, between 1 and 2, in the local Seacoast bank account, from which we'll pay operating expenses, including the $1.1 million we just approved. Now, coincidentally, Water Walker determined recently to expand its offerings to a national platform rather than just the state of Florida. So Anne Marie Soriano and I are reviewing the terms of this change to be certain that we'll continue to get what we agreed to only a month ago. We're pretty confident we will. That concludes the treasurer's report, unless anybody's got any questions.
That's good. Thank you. We like remaining in good, sound financial condition. That's good. And our agencies like that, too. Okay, the Executive Director report, Anne Marie.
Okay, I don't have a whole lot more than what I have in my written report, but I did want to expand a little bit on the, and say publicly that congratulations to Jenny for being accepted to the Leadership Indian River County program this year. So she will be attending those starting in January, and they happen to fall on our third Thursday monthly meeting again, but they're held in the daytime, so she will do that from January to July. So there will be a graduation, as there always is at the end of July. So I'll make sure you have all that info in case you're interested in attending that. The mental health first aid training that is scheduled for February 7th at Northern Trust. We can have about 30 people in that class, so we have obviously the 7 trustees and our staff to do that. I did the training already, so Jenny and Kate and Jennifer, if she would like, will be included in that training. So I've chosen some of our organization CEOs and board members if they want to invite those. So I've put a note out to all of them to open that invitation, and anyone else that you can think of or know. We probably have 9 or 10 spots left that we can fill with those people. But so if you have any ideas, you can just let me know, and I'll add them to the list. And otherwise, I just want to wish everybody a Merry Christmas, Happy New Year, and that's it.
Thank you. Okay, our funded agencies report. We have Healthy Start first. Actually, more than half.
Yeah, do you need me to do anything? Oh, perfect, thank you. Good evening, trustees. Thank you so much for having us and for this opportunity. My name is Elizabeth Bublitz, and I am the Associate Executive Director with Indian River County Healthy Start Coalition. And today, or this evening, we have Ms. Andrea Berry, our fearless leader and Chief Executive Officer, and our 2 wonderful program supervisors, Ms. Cheryl Martinez and Kristen Crocker. They represent both of the programs that we will be discussing this evening, Nurse Home Visitation and Nurse Family Partnership. Oh, and their titles are right there, sorry. So just wanted to provide you with a PowerPoint that had some updated information and just some friendly reminders. So our mission is to establish and support a local system of care that optimizes the health of moms, babies, and their families living in Indian River County. And we are able to do this with our great collaborations with our community partners, our program supervisors, and the help of the community. So that is kind of the theme for tonight's meeting, is to celebrate these collaborations and these partnerships and these relationships with these wonderful people and organizations that have truly helped us change lives and help our residents here in this county. So we're celebrating today. We stand here before you to celebrate our community collaborations, programs, and partnerships. These efforts have helped decrease infant mortality rates within Indian River County. Indian River County Healthy Start Coalition is happy to announce that our rates are the lowest that they've been in over 25 years. This is huge. In 2016, Indian River County had one of the highest in the country for infant mortality rates among Black women. And in 2017, that number became 0, and in 2018, that became just 2. So thank you all for celebrating with us this evening, and I'll definitely get that picture to you after this evening. And this was at our annual coalition meeting, so this was wonderful for all of our partners to be able to come together and celebrate. Here's just a graph to represent the decrease in numbers. So this dates from 1989 to 2018. We showed this back in May, but it was preliminary data, so you will see some similar data that was presented then, but now you have verified numbers to go off of. So we wanted to provide you with some updates regarding some additional projects that we have going on within the community. One of them being presumptive eligibility for pregnant women, also known as PEPW. We had a wonderful meeting back in October with Representative Grawl, where we addressed our current status with our application and how we are working with the Department of Health. She was extremely interested and has been a great partner and advocate for us, and she's also part of our fetal and infant mortality review. So we have to give her a big thank you for her continued support. We also met on October 22nd at the Partners Collaborative Group meeting, where we discussed PEPW, where it was on the agenda, and Cleveland Clinic Indian River has expressed interest in completing that application and having PEPW be part of their hospital. Excuse me. With that, we have been in communication with Megan McFall, and we will hopefully have an update after the first of the year. So I just wanted to keep you all updated on the current standing of PEPW.
Let us know if they need a push.
Okay, we'll definitely keep you in the loop. Next up is our fetal and infant mortality review, also known as FEMR. Our mission with FEMR is to improve the health and well-being of women, infant, and families in Indian River County through an empowerment-based model. This was a mission that our team, as well as the Southeast Florida Health Council and the Department of Health, came up with for Indian River County. So that is our mission statement. And our goal is to identify opportunities and promote systemic change that result in the reduction of fetal and infant mortality. This project has really ramped up over the last couple of months. Our main community partners are the Department of Health, the Health Council of Southeast Florida, and we just hired Ms. Dina Shatley, and she is going to be our program coordinator to really help run day-to-day logistics to get this project moving. But one of the things that I wanted to highlight, let me make sure. Okay, so our FEMR budget is laid out for you there, so you can see where those funds are allocated and how they're being used. If you have any questions, let me know. But this is the big slide that I wanted to touch base on. We received funding back in January of 2019, so earlier this year, and through that we were able to solidify those contracts with these community partners and really be able to set up our first case review team. We had our first meeting on November 22nd, which yielded 21 participants that represented community members from all different backgrounds. So we had law enforcement, we had local representatives, we had mothers who have actually lost a child, and the Department of Health. And so it was just a great opportunity for all these wonderful minds to come together to really understand the cases that we are reviewing and how we can create that systemic change. Over the next couple of months, we have a heavy schedule. We are going to be reviewing up to 20 cases and have meetings scheduled every month, really up until the end of April. These meetings are 4 hours long, and we hope to get through at least 4 to 5 cases at each one of those meetings. Additionally, we are putting together a community action team or community action group, which will then take these findings from the case review team and actually be able to implement our findings out into the community and be able to express that change that may or may not be needed. So we have already reached out to the CAT group, and they'll start meeting as soon as our CRT group ends. And then at the end of that, we are hoping to, we will provide a FEMUR summit, which will be able to provide the community with all of the results and outcomes from this project. So it's been a great learning lesson, and we have a lot of great buy-in from key stakeholders in our community, and we're really excited to see what 2020 holds for this project. Just a friendly reminder, this is our coordinated intake and referral flow chart. So this just shows how our mommies get to our services, and this is how we're housed within Partners. So I just wanted to do a quick little reference to that, just as a friendly reminder. And then these are this is our prenatal screening report that we pull from Well Family. This information is sent to the Department of Health at the state level, as well as to ACA. So these reports are pulled monthly, and we are also using them for our quality assurance and quality improvement measures. I just wanted to point that we are it's just a snapshot. This covers the time frame from October 1, 2018 to November 30, just to try to give you guys a great idea of what's currently happening. And I want to note that women who completed initial intake is higher than the state's average at 81.9% compared to 57.5%. So Indian River County is getting those mamas. Our postnatal screening report, very similar. This is focusing on the infant. The same date range, so from October 2018 to November 30, 2019. And once again, infants who completed initial intake is higher than the state's average at 83.5% compared to 64.2%. And I have a lot more information if you guys ever want to know anything additional. I can always send it to you. These are our Healthy Start performance measures. This is pulled from almost like a back-end from Florida Charts through Healthy Start. This is one of my favorite reports because it just shows a great snapshot of obviously our performance measures and how we're currently doing. But our prenatal screening rate is at 89.45%, and you can see there that we're sticking roughly or just around the state average, so we're neck and neck, which I think is awesome. Just some highlights there. And then this is also available to you to compare to our report that was back in May. So once again, just the preliminary data compared to the verified data. So not too much has changed here. And then this is our financials from October 2018 to November 2019. So you can see here that we're par for the course. Everything looks good. There is one, I wouldn't say discrepancy, but I just want to note for Nurse Family Partnership, it is over the allotted amount. We did receive let me not misquote. Nurse Family Partnership in 2018, we received $25,000. And then in 2019, we just received another $25,000, and I just want to note there that there's additional from what we just received from this past month. Yes, represents 13 months. Thank you. And then for nurse home visitation in October 2018, we received $50,000, and for this coming year, October 2019, we received $60,000, and then we have received $50,000 for PEPW, which we will keep you updated on. I would like to invite Cheryl Martinez up here to speak on behalf of Nurse Family Partnership.
Good evening. Thank you again for the opportunity to be here today. And I just wanted to give an update on the program. And most of you are probably somewhat familiar with it, but I'm the nurse program specialist in the program. Nurse Family Partnership has been around for about 40 years, so it's been around in communities and making big differences. It's a very intensive, holistic approach to home visitation programs, and what's great about it is that they are able to be seen by registered nurses from when they are 28 weeks pregnant, and we follow them all the way up until the baby turns 2 years old. So we're able to be in the homes and to assess safe sleep and where your baby's sleeping and seeing what other things that are needed. The Healthy Start Coalition, they really work well with the families. We might have a mom that had a flea infestation that they couldn't afford, anything. So Healthy Start bought them the do-it-yourself things to work on the yard, to get rid of these fleas, because once the babies get here, we need to protect them from those things. And they go all the way up to a mom that had high blood pressure, uncontrolled, that they brought her a monitor. So we can assess all of those things by being out in the homes, and really building these relationships with the families to provide that care for them. So from October 1st of 18 to September 30th of this year, we've enrolled 33 clients between that time. 27 of the clients are active, because we do have sometimes the clients might take a break or just can't find them. So just even throughout that, we have been able to have 27 active clients. We have an 81.9% retention rate. And for our conversion rate, that refers to, we do work with the CINR, the connection specialist. So what will happen ideally is they go into the doctor's office and they fill out the newborn screenings, and then those get sent over to our connection specialist, and then she can see whether you're a first-time mom, can we offer you this program, or if it's any other Healthy Start programs that's available for you. So we have that. And so once we get those, our county has a 66% conversion rate. So once we get those referrals that actually get into the programs, and that's compared to 55% for the state, well, for Treasure Coast, and then 44% for the state, and then the national is at 35%. So we do great once we do get the moms referred into the programs. We've had 13 babies born. 2 were 36-weekers, but they had no problems. They were not in NICU, didn't cause any extra. We were right there to provide whatever support they needed for it as well. And we've had 11 born full term. And we really do a great job with initiating that breastfeeding, because we know that that helps reduce the infant mortality rate. So we really push the breastfeeding, which we have a great percentage of 92.3%. And it's just a great program. I love it. Is there any questions you had about the program?
Was it just for first-time moms?
This is for first-time moms. And we do have it if the mom becomes pregnant, which is not ideally, but they still do stay into the program until that baby turns 2 years old. Or we do have exceptions that if she's had a loss, but they don't have a baby, even though she's been pregnant before, she still would be able to be a part of the program.
So in that time period, tell me a relationship. 33 got enrolled, but how many first-time moms were there in that time period? Do you have any feel? Yeah, throughout the county in that time period. Are you getting most of the first-time moms enrolled? Are you getting half of them? Are you getting?
So this program, Cheryl's our only nurse for Nurse Family Partnership. So right now, this is our first kind of step into this program. So Nurse Family Partnership is a very evidence-based program. It is strict to fidelity. So the first-time mom component comes from that. So right now, 33 is that's her limit, as many as she can take. So, 25 is really all she can take. So 8 of those maybe left and then came back. So that's her caseload is 25. We would like to add more nurses as this program stabilizes and becomes more successful. But for right now, we feel pretty good about the one nurse. We actually are eligible for some expansion funding coming from the federal government through some
neonatal abstinence syndrome prevention monies. So we might actually add a secondary nurse to this program if those funds do come through.
Are you turning people away?
No, as of now, we're not.
Okay, so you're at capacity, but you're not refusing to take new patients in, new moms.
At some point, but well, what we hope happens is there's a natural attrition rate, but then there will be a time.
Yes, where you might have to add somebody. Well, that makes sense,
Yeah.
right? Okay,
Well, thank you.
Thank you.
thank you.
Thank you.
Good evening. Thank y'all again for supporting us, continuing to support the nurse home visit program. So as you guys know, this is the program where we typically meet at the bedside for postpartum moms and extend or offer them a nurse home visit. We try and see them within that first 5 to 10 days that they're home, just kind of as an extension of their hospital stay. Is you can see the dates here from October of 2018 through November. We did 617 home visits. Total for our fiscal year, we were right at 512. We have increased since starting the program, but we are still at around a 52% acceptance rate. This is someone coming into their home. Also, sometimes the mothers are third-time mom, or my husband's a doctor, so we do get some refusals.
That's not a good sign, is it? No, I'm kidding,
Well,
I'm kidding.
right. But I will say that we have had several even that are professionals or, that still accept the program. It has been nice that we have been able to extend it to everyone, but our 52% of those that we served in the home were Medicaid, but it's been helpful to be able to extend it to everybody because I think everyone certainly deserves it and can benefit from it.
Could I ask you a question?
Yes, ma'am.
When you ask mommy, do you approach it, would you like a nurse home visit? Or do you say, we will be making a nurse home visit? How do you approach it? If you said that to me, I would expect that you would be there.
Yeah.
But if you say, would you like, I would say, oh, I don't know, I've got, my husband's a doctor, he might be there or not.
Actually, we present it as, have you heard about our nurse home visitation program? If they say yes, because we have several now that were our repeat customers. If they say no, we simply say, well, it is a free service that we offer to all moms that deliver in the county. The purpose of it, as you know.
That's important,
Right.
the purpose.
Right. The purpose of it is you're here for a very short stay, and it's kind of a whirlwind. So the idea is for us to be able to support you in the home. It's not a home inspection. We come out just to support you, to look at you, to look at baby. We bring our baby scale to weigh baby, make sure they're gaining weight, make sure they're not getting jaundice. We check you over. We listen to your heart and lungs, do your blood pressure. We're there to educate, support you with breastfeeding, make sure your breasts are doing okay, and just make sure that you're getting off to a good start.
Right. I think the way, the way you approach it and present it is in a positive manner to let them know that things can happen. And so we are another pair of eyes, and I think the positive, that, you'll build your program that way and not just, well, it's a free service and just, we're coming out, so when do you want us,
That's true. We may
Exactly.
need to take a little more assertive approach.
Exactly, assertive. That's a good word. I must remember that one.
That is true, because sometimes we will have someone that just shuts us down. As soon as we say home visit, it's, for some people, that's a deterrent.
Right,
So.
this is very important for mother and baby, and so it's something
And
that's
to
happening
get-
all over the country and
Get the doctors to,
oh, yeah, right, well,
that would always be helpful. So,
right.
back to the statistics, just with our mamas that we've seen, just to kind of let y'all know how it has benefited us and benefited the moms and us as a community, is within the past year, 60 calls have been placed from the home. So in other words, there's been something unusual or abnormal that has required a phone call to the physician or pediatrician. Under most circumstances, it's been blood pressure issues or postpartum depression. Occasionally, we've had some infant weight loss or even jaundice, but for the most part, it's been mom things. The good thing about that, I don't know if I should say a doctor's name, but some of our doctors have sung our praises because we have realized or picked up on that preeclampsia. Preeclampsia doesn't always mean before delivery. For actually 6 weeks postpartum, you're at risk for that. So we have had women that had no idea, and we go out to the home, their blood pressure is through the roof, and they're completely asymptomatic, but they're still at risk. So because of that, they're sent for additional testing, sent to the doctor's office immediately. And under most circumstances, we have saved, an ER visit or a hospital readmission. Occasionally, though, because of that visit, we've generated a hospital readmission, but possibly saved a mom from seizing or worse. So I have to say that I love this program, and I think it should be nationwide. It really should. I mean, postpartum, we have a maternal morbidity and mortality problem, and I think this would help to alleviate some of that. 100% of our moms, I'll move on to, are also seen by a Healthy Start lactation counselor at the bedside. We see everybody. We've been fortunate to be welcome at the hospital. And about 85% of our mamas initiate breastfeeding. That's not to say that they're doing it 6 months later, but they're at least trying it in the beginning. Do you mind clicking one? I just wanted to touch on a couple of, y'all can certainly read this, but a couple of nice things. The third one is one of my favorites. We always send out an electronic satisfaction survey so the moms can do it anonymously. And one of the moms had mentioned Elaine, who's our full-time home visit nurse. She was the nurse for this mama's son and also now the daughters. Both times, Elaine showed so much compassion and understanding towards me. This mama suffered both times with postpartum depression. She mentioned that Elaine made her feel comfortable about talking about her feelings and emotions, and both times she called to have me helped immediately, and quite honestly, this woman said the woman saved my life. She's encountered several nurses. Some are wonderful and some are just nurses. It takes a special person to be a nurse like Elaine. So and I've got pages and pages of these things, so I just want you to know that I feel like we are making an impact with this program. The next one, it's long, I'll let you read it, but this was actually a little story that the nurse Elaine had written and had to do with a young mom that they were struggling a bit at the hospital because they were not from here, so they were very fearful and scared. And by the end of their visit, they had initially been like, "You're coming to my home?" Well, we have some of our other people in the hospital singing our praises too, and so finally it kind of softened their heart, and they were like, "Okay, you can do the home visit." And it ended up that they were extremely happy that they did. So, yeah.
Even more of a reason for the more aggressive approach. Years ago, you would spend at least a week in the hospital having a baby. That doesn't happen. And so this home visit is critical to me. So it's a critical program.
Well, and I think it's just got to gain a little more momentum. Now we're seeing some second-time moms.
Right.
Girls are talking about it and even saying, oh yeah, I heard about that. That's awesome that y'all do that. We're getting such praise and thanks for it. So I think that
Right.
as it gets a little more normal, it'll be more accepted.
Well.
You know, in Europe, it's like, oh yeah, of course you're coming to my house.
Okay,
Okay?
all right. Well, good luck with it.
All right, thank you guys.
No, but to follow up on some of the things that you've been talking about, I don't really remember precisely when Healthy Start located at the Partners Program, but I think it was like 2015.
Yeah, I think you're right.
And so you look at the data here on infant mortality, and now we've gone from above the state average to below the state average. The trend is clearly strong, as you've emphasized. I think what that reflects is that the quality of care has been pretty good by the OB, in fact, excellent by nurses and OB, but the incremental care provided and relationships provided by Healthy Start has really made a difference.
Well, thank you.
And I think you should be really proud of that, and certainly we're proud of you.
Thank you. And I will mention that it's also a true decrease because we also track fetal and infant mortality. And so sometimes you'll see if infant mortality decreases, fetal mortality will rise. But what we're actually seeing is a true decrease, which means both are decreasing, which is amazing, which is what we're aiming for. So thank you for that. I also wanted to, do you have any more questions before I? No. So I want to make sure that I really would love if one of you would be able to be on our community action team with regards to our fetal infant mortality review process. I will work with Emery to try to see whose schedule would work best, but I think that when you guys see the work that's being done and the depths of how we're looking at, any systemic failures that have happened with these families that cause these deaths, and that what we can do as a community to address those issues, it's going to be very impactful for you to be in the room for that. And lastly, thank you for Elizabeth for leading this. And I want to acknowledge Cleveland Clinic for implementing a maternity and paternity leave policy. Amazing work. And it's a tribute to you guys for choosing a great partner that acknowledges that parenting is difficult and deserves a little bit of time to recoup, bond, and have a good start, a healthy start of parenting. So thank you.
Thank you very much.
That was
Very
an
nice.
important announcement that they made relative to that, and big change, so it's
It's
good.
important. And I hope everyone in this community takes note and takes their lead and offers that type of support to our parents.
Thank you, and thank you for everything that you guys do. You really are
Thank
making a change in this community. That's important.
Thank you so much and happy holidays.
Happy holidays. Next up, we have the VNA, Pat and Lundy. It doesn't say Lundy, though.
It doesn't say Lundy, yes. It says Pat Nipper.
Just saying.
You have the right name, Pat Nipper. But I just want to say I agree, it has been a good year. And really, because of the trustees and your foresight, bringing the Cleveland Clinic to our community, all the great work that you're doing with all of the nonprofit healthcare providers like Healthy Start, which is amazing, the stuff they were just talking about there. I love that visiting nurse program. Obviously, I would love that. But the VNA has grown a lot this year as well. And sort of as a reflection of that growth, we need to focus and align against some very strategic imperatives that we are looking at. And as a result of that, we have decided that Pat Nipper really is the right person to lead us forward in our strategic alliances and special projects. We have some very interesting things that we are focused on right now. You can imagine most of them do revolve around the Cleveland Clinic. But Pat's done a great job. We feel that the hospital district is a very important alliance for the VNA. We've been great partners for a number of years and obviously want to continue in that way. And so I've asked Pat to accept the position of Director of Strategic Alliances and Special Projects, and she has graciously accepted that. As part of her initiation, she gets to present the VNA statistics to the trustees, which she will do tonight. And you'll see, obviously, in Pat Nipper fashion, she took what we did before, threw it out the window, and sort of redid it and done a fabulous job. So I think you're going to appreciate what Pat has to say tonight. So I just wanted to say thank you to Pat. She's done a great job. She's supported this community exceptionally well this past year with the mobile clinic, with the Vulnerable Village program, with the Positive Change initiative, and we've seen a lot of great things happen for a lot of people as well, and I'm really, really proud of her and just the work that she's done. And thank you for the funding that you have provided the VNA to make that happen in the community. So, all right, Pat, come on up.
Thank you for those very kind words, and good to be here. Good evening to the esteemed trustees, and thank you for allowing me the opportunity to speak to you this evening. Kate, I have it. I'm so sorry. Number one. So I wanted to just go over a funding recap for October 2018 through September 2019. We actually were 33% are actuals to budget, and that's something that we really cannot really predetermine. We did ask for an increase in our budget this past grant cycle because of the federal poverty guideline being raised from 100 to 150%. And so we thought that would actually have an increase in a number of patients, but that wasn't actually reflected this year, but we think that may be reflected as we go along now from October 1. And so we have a nice under budget there. So money that we didn't use that can go back into the district and be used for other programs at a later date. Our hospice services, again, we were a little bit lower this year than we were in the previous year. The total hospital days in the prior fiscal year were 300, the total days, including everything that you see there, room and board, GIP, continuous care, routine, and respite, were 373 in the previous fiscal year and 221 this year. We did have an uptick in physician visits. We had 17 in the previous fiscal year and 27 this year, so more physician visits to hospice in the home, actually. So, and that shows us, we believe, that more patients are getting into hospice sooner, and more patients are able to be in their home for hospice care. We think that may be something, so we'll have to keep looking at that trend in the coming months and certainly for the next fiscal year. Our quality scores for hospice, which are from Hospice Home Compare, we are doing either at or better than the Florida and national reported results for patients who would recommend VNA hospice. These are family ratings, obviously, from the patients' families. For VNA hospice overall patient care, we are exceeding both Florida and national quality scores. For chart preferences for life-sustaining treatments, we're very proud that once again we are at 100%. We were at the same percent last year. And patients screened for pain at the initial nursing assessment, there's been no change there from the last previous quarters. And we are above Florida, just a teensy bit below national, but above the Florida quality scores. Any questions on the hospice piece? Moving to home health, this year for our indigent population, we had a total of 1,231 patients, which represents a 17% decrease from the previous year when we had 1,491 patients. We attribute the majority of that decline, if you will. It's not a decline. Again, we take the indigent patients as they come to us. We just saw a lesser amount this year. And Kathy Orton, I did speak with her at length, actually, about our ability to determine that, and so far we've not really had an ability to determine that other than year over year the amount of funding that we typically request. And so we'll be looking at that a lot more closely year over year from a data perspective. But the skilled nursing visits were down about 150, and physical therapy down about 50 to 60 visits. So that's what we attribute the overall lesser amount of patients that we saw this year versus the previous fiscal year.
But no understanding of what's going on or why, or less referrals? I mean, are you getting referred less? Are you?
Well, so it's indigent patients, so it's something that we want to do a deeper dive into and look at some of those, Mary Beth. I think we do want to look at clearly the whys. I don't know that today, but it's certainly something that we can look at in the next couple of months, and we don't have to wait until the next report. We can clearly get that information to you as,
Because
as we
they're not going
uncover it.
somewhere else.
Right,
Where
exactly.
would they go?
Right, that's,
Where are they going?
that's
Exactly.
the point,
Yeah.
so.
And it says on the chart that it's visits, but you had said that the 1231 are patients, is
Patient visits.
patient visits.
Patient visits, yes, I'm
Okay.
sorry, yes. Well, we're talking about two different things. So when we talk about the, let me go back.
And
So
this is
when we talk about the hospice, well, we talking about home health now or hospice? Did you want to, are you asking?
The chart you were just on.
On home health, okay. So on home health, when we look at these are actual visits.
Okay,
Yeah, so,
okay, so not patients.
no, I'm sorry,
would
it's not
be-
patients, it's visits, I'm sorry, yes. If I misspoke, I apologize,
that's
it's visits, yes. The home health quality scores, again, we are up where we need to be and down where we need to be. So patients who rate VNA a 9 or 10, we are far exceeding Florida and national statistics. Patients who would recommend VNA TC, again, exceeding Florida and national percents. We are down 30-day rehospitalization and 60-day rehospitalization, which is where we want to be down, where our numbers are lower than Florida and national percents, and we're very happy about that. And we're right about even, I would say, nationally with the emergent care without hospitalization, patients that come to the emergency room but are actually not admitted to the hospital. So we're a little bit above the Florida standard there, but comparable on par with the national standard. So we're going to be looking at this data and comparing more year over year, which we have not really presented to the district in the past, the year over year, and digging a little bit deeper into the whys in some of these either decreases or increases in numbers of patients and number of visits, and also tying the number of visits to the actual number of patients. Because while visits could be, 1,000, how many patients does that actually equal? And that's something that Lundy and I actually talked about earlier this week as something that we want to know and dig deeper into, and we want to be able to give you that data as well. So that's something we'll be looking at a lot more closely. The mobile clinic. So we had an uptick in patients this year, 40% more than the previous year, 2,138 for the fiscal year that just passed, 18-19. For 17-18, we had 1,524 patients, so that was an increase of 40%, excuse me. At the same time, we had a 50% decrease in the number of patients that actually had qualified for the financial assistance program. So we're seeing lesser number of patients that are in the financial assistance program. And we attribute that to the patients that are paying $5 to come for a visit. They don't have to qualify because of the generosity of your funding for those patients. We do try to get them to establish with a primary care facility. We created new flyers that help them to understand that they can go not just to us to qualify, not just to the district, but they can go to TCCH, to Whole Family Health Center, to the Mental Health Association. So we are encouraging them still to do that. We worked with Jenny this past couple of months to get people actually from the source qualified since from June through June through today, we've seen more than 60 patients at the source, and about 1/10 of them have actually been qualified for the financial assistance program, which we're really proud of, working together in partnership with the district. So we thank Jenny and Daphne for helping us with that and partnering with us and being on site for that. Moving on to the mobile clinic. So this is a piece of my new title and projects that I'm going to be keeping. And so we'll continue to be working with the population health initiatives on the mobile clinic. As you know, we continue to serve patients that have one or more social determinant of health on the mobile clinic. I just want to give a call out to the team on the mobile clinic. They're really I call them the unsung heroes of the Visiting Nurse Association. They're They're an incredible team of people. Elizabeth Sofranco Adams, Ashley Baum, Nancy Mace, Susan Strader, those are our APRN team. And our drivers and clerks, they double as a driver and a clerk, Barbara Brower and Shirley Craig. They do a tremendous job really getting these patients in and getting them registered, really understanding their problems and how we can help them. And so I just want to call them out, and they do all the work for the data entry, for the health screening tool. They work with the Positive Change Program patients and so forth. So just an incredible team, and I just want to give them a lot of credit. The last 3 months, we have supported the transition of the Gifford Health Center from the Health Department to TCCH, and we were very happy to do that and proud to do that, and we work very closely with TCCH, and we're so pleased that the Churchill Coast Community Health is doing so well with the Gifford Health Center. We're actually going to be starting our quantitative survey analysis next week. We finished all the questions and have that approved all around. So we'll be starting that, and we're looking forward to getting that data back to you. VNA is an active member in the Gifford Health Center Advisory Committee led by Tracy. We had a really good experience over the past couple of months, really working together and identifying how we can help and continue to help to support not just the transition, but beyond the transition, so that patients will use the Gifford Health Center as it's meant to be used. We had a success at the community resource fair with vendors. Unfortunately, we didn't have as many people as we had hoped at the community resource fair back in November. There were some competing activities, and unfortunately, one of the most beloved pastors in the community had passed away, and his day-long funeral was that day as well. So it was unfortunate, but it was a good opportunity for the vendors and community partners to get together in that community on site at the Gifford Youth Achievement Center to really help each other understand and how we're all working together to support this community. So it was a positive experience. We hope to do it again, maybe even something we could do twice a year. We've kind of talked a little bit about, would that be twice a year, maybe once a year, and seeing how we can get more people to come out to that. And thank you to Tracy for the work that she's done to lead that. It's really been a very positive group. We're back in Sebastian. We've been at Riverview Park since October, and it's been a very positive entree back into Sebastian. We went out and met with many people in the community, churches, local pharmacies, the police. We met with some people that interface with the homeless population in Sebastian, and so we've really been building volume there over the last couple of months, and so we're happy to be back there, and we've gotten some really positive feedback from the community. We're still exploring new avenues in South County. Been in touch with Diane on a regular basis, and we're hoping to get there. However, one of the things that we are going to do in the interim after the first of the year is to do every other Saturday in the same location as our Tuesday location in Oslo. So it's been an extremely important location for us. Patients in South County really need us. So we're going to go back there on Saturdays, at least every other to start out, and we'll keep you informed on how that's going. We have had a new location in the West Corridor at Sam's Club. It's been a little bit slower to build. My understanding is we were there years ago when there was a large homeless population behind Walmart and behind Sam's Club, and it was a very successful site for us at that time. It's been a little bit less so for us, so that's why we're actually we've been looking at the data and pockets of when we don't have patients, and so that is really what led to the decision of moving to South County on Saturday. We'll continue to interface with the school district to see if we can get to where we need to be, but we certainly haven't dropped it. We've not dropped it, nor has Diane. She's made a little bit of progress in them agreeing to set up a meeting with us after the first of the year, and we're hoping we can do that shortly after the first of the year. So that's what we've been doing over the last couple of months. The mobile health program, you've read this. I don't really have to go over this with you, but we do have, some new things that we've instituted. One of them is a dental education program for children. We have a lot of children that come to the mobile clinic with their siblings who are first with their parents, but then one sibling is sick or needs a physical and there's other siblings there. So we utilize that time to go through this dental education program with the children. It's a fun sort of a maze that, you know, has a toothbrush along the way and, you know, fluoride and the different types of treatments that children can have and why they should brush their teeth. And it's a fun sort of interactive little program that one of the APRNs came up with. We're actually working on an early pregnancy program, which is in development, and listening to our esteemed colleagues at Healthy Start, we were approached by CareNet actually to help them with some early pregnancy education, and we were thinking perhaps of alleviating the burden on partners in the very early stage of the woman, you know, discovering the pregnancy before they get Medicaid. But now hearing what you have come up with and that immediate need to get that 45 days. So we'll connect with Healthy Start first after the first of the year, and then we'll likely partner together to see what we can do to get that, you know, to just help with that early education, and if there's a need for people to have that immediate sort of same day and get people out there that don't have insurance. So we'll continue to work on that. We're doing a lot of preceptorships on the mobile clinic. There's a tremendous amount of interest in community health from both the RN and the APRN community. So we did a number of preceptorships this year from both the RN to BSN program as well as the BSN to APRN program. So there's a lot of interest in community health and wellness, and so we're happy to be a part of being able to train the future of community health as well. So we've done a lot of that on the mobile clinic. Our statistics, July to September, comparative to the sites. This is a look at the sites. So clearly our biggest need and our highest volume continues to be South County and Oslo. And because Gifford, Wabasso, and Sebastian have so many zip codes, but if you look at all of them combined, clearly Gifford, Wabasso, Sebastian, and Oslo are the biggest areas of need. So again, we continually look at this data to evolve where we need to be. We don't want to change our sites too often because people get familiar with where we are and they want to count on us being there. But at the same time, we're continually looking to see where is that need. Something a little bit different that I've never really showed before is the zip code analysis. So we always look at and show you where people are coming from relative to the site. This is a zip code analysis relative to where the patients actually live. So, and it does correlate with a lot of the site work, which is interesting. So again, Oslo, Gifford, Wabasso, and Sebastian, these are clearly where the patients live. And we're really happy to see this because it's the first time we looked at it this way. I mean, you get this data every month, but we haven't looked at it in slides form to be able to really understand who is using us, who needs us. And Jenny and I talked about this when we went on our tour, our 2-hour tour of South County. So clearly we are reaching the people that need us, and the people in these vulnerable village communities that we started out with in October of 2018 clearly are utilizing us, and we just need to do more to find those kinds of locations where people will accept us there and will come there. So we continue to do that on a regular basis. Year over year, fiscal year 17-18, 18-19. Again, this is just a look at by month, and you can see that we exceeded the volume from the previous year in every month, actually with the exception of August, where we had quite a year in 2018. And I think that was Lundy's pilot program there at GYAC, where we opened back up to all the kids for free physicals. And I remember we had a huge volume on a couple of days that Lundy was actually there himself. And so that was kind of a neck and neck. But you can see we've really increased the volume significantly from the previous fiscal year. Just to give you a look at the patient mix, of the 2,138 patients, we have about 70% are adults and the other percent are pediatric. And a lot of the pediatric are physicals, probably 50-50 mix between physicals and sick visits, mostly otitis media, colds that the children have, viral type things. Positive Change Program, what we're doing really is around the health education, disease prevention. We continue to do that. I'm really pleased to tell you that we just hired a part-time person who came to us through a donor donation. She's actually a PhD in special education, retired from that field, and is going to work very closely with me and the team on the mobile clinic to really dig even deeper into this data for the Positive Change program and some of the other health screening initiatives that we have on the mobile clinic. We're really creating, this is feedback that we're getting both from the nurses as well as the patients enrolled in the Positive Change program, that we're helping patients to understand what they can do, and that's because they're helping us to understand how we can help them. We do custom care plans every time they come between the visit that they come to and the next visit, so everything's customized for what they want to achieve and what our recommendations are to help them do that. And I think the key is that we're giving them realistic, incremental steps that we hope will lead to some kind of long-term awareness and long-term change to improve their quality of life and outcomes. So we're continuing to enroll patients. We just enrolled patient number 42, and we are very excited that we just made an agreement with the Whole Family Health Center. They are going to give us 2 patients from the Whole Family Health Center where we're going to pilot, working together on those patients. So those patients will have a continuum of care for sure. And we will have that warm handoff between them and us for the Positive Change program. They're actually going to co-locate with us in Oslo 1 day a week so that we can encourage and have that immediate availability to do that handoff for the primary care practice, and we hope to do that with TCCH as well. Vicki and I have been talking about speaking with their chief medical officer, and we plan to do the same thing with TCCH as well. So we're very excited about that because that will support that long-term continuum of care, because most of these patients have a significant number of health problems. That's number 40 patient that enrolled on September 24th, and those are 2 of our community wellness preceptor students that we had, and that's Ashley Baum, who's done on the right there, who's done the majority of work with our this primary care Positive Change program with our PCP patients. She's really our rock star with that program, and that's the patient in the middle. And she's actually already been back for her 90 days and received her exercise tracker just this week. So we're really excited about that. These are some of the challenges and successes that the patients identified. I won't go through them really, but I want to just tell you that the biggest, I think, what we're most excited about is that the patients in the Positive Change program are telling us that they're involving their families. They've seen what their unhealthy choices have done to them, and they're looking at how they're passing that on to the next generation, their own children, and in some cases also their partners, and they are involving their families in meal preparation, making healthy choices, exercising, doing small incremental changes, but they're really have a focus on not just themselves but on their family. The stresses are the usual stresses, I think that we all have, but we continue to work with them on a daily basis to do that. Just reading one sentence, this was from a gentleman in our program actually who said that, I blocked out the other part of it because it was quite personal to protect his personal information, but the last line is, "Please accept this letter as an apology for he missed an appointment and a heartfelt gratitude that he is doing things now that he did not think were possible before he started the Positive Change program." And that's something that we really feel proud of, and we really feel encouraged as well to continue this program and to continue to help patients. Together for Health Collaborative is kicking off on January 9th. So if any of you want to be there, I've gotten a huge response of people coming to our kickoff. We decided we're going to look back on last year. What did we do right? And what could we do better? And then make a plan for the current calendar year. And we're actually going on the road. We're moving the Together for Health Collaborative once a month to the new United Against Poverty Center. Annabelle and I, when I went through there and I saw the collaborative partner space, just said, "Oh, wow, can we bring it here?" And she said, "Oh, absolutely." So VNA is going to have an office there as well, and we're going to be meeting once a month at the UP Collaborative, and that's a true collaborative to the collaborative, because that's where we need to be. We'll be be surrounded by other collaborative partners, and we'll be able to make, we think, some real-time decisions and help people in that moment. So thank you very much for everything that you've done for us this past year, not only for the funding, but for your partnership and all of the advice and counsel from each and every one of you, from Anne Marie, Jenny, Kate. You've just all done an incredible job supporting us, and we're so grateful for the continued partnership with you. I want to wish all of you a happy holiday and a very happy and healthy new year. And again, thank you with all my heart for everything you've done. We really appreciate it.
Any comments, questions?
I walked away.
Don't walk away.
My apologies.
I think you ought to make sure you stay well, Pat. You're doing a terrific job.
Thank you, Anne Marie. I wash my hands many, many times a day, and I'm hoping.
Okay. All right. Keep it up, honey. You've got a lot of energy.
Congratulations on the
Thank
new
you.
position.
Thank you all
too. I
very
think
much.
You'll do a great job with
Really
that.
appreciate it. It's a team effort, and clearly we together we do much more than we can do alone. So thank you all very much.
Thank you. Any unfinished business? Any new business? Any other business? I know, it makes me crazy. Any public comment? Okay. I would like to wish everybody a Merry Christmas, a Happy New Year, and I hope that you all have the best present of all, which is to be with family and friends over the holidays. And be safe and enjoy every minute of it. And we look forward to being together again in 2020. Okay? So thank
Okay.
you all.
Thank you.